Thank you, Dr. McDade. Mr. Speaker, distinguished officers, trustees, members of the House of Delegates, visiting State Medical Society leaders, friends, and guests. Thank you for entrusting me with the Illinois State Medical Society presidency during its 175th year. It is a sincere honor to stand before you today. It is an honor because I appreciate just how important ISMS really is to physicians and our patients. Here at ISMS, we can make a difference. Here at ISMS, we have a voice. And here at ISMS, if we work together, our combined voices are a powerful force in Illinois. I'd like to share my vision for how we can come together as physicians, leaders, and as colleagues where we live and work. How we can harness our collective knowledge, experience, and wisdom. And how we can advance policies and establish an environment for providing the best possible health care for our patients. I am an emergency physician. Emergency physicians deal with a spectrum of cases, from myocardial infarctions to a simple chin laceration. From early on in my career, when a child presented with a facial laceration, there was a common parental request. Doctor, would you please call a plastic surgeon? At the beginning of our careers, my colleagues and I would try to encourage the parents to allow us to suture the child, but to no avail. Not realizing it at the time, I now easily recognize the need for a plastic surgeon is driven by imprinting. At some point, a trusted friend, family member, or perhaps the family's pediatrician imprinted on the worried parent that when you or your child are in the emergency department with a laceration, request a plastic surgeon. Any information to the contrary that we try to convey competes with their imprinted belief. Imprinting isn't necessarily a bad thing. For example, I'm imprinted to trust a certain mechanic or painter because I know I can rely on their work, quality, and ethics based on past experience. Imprinting can be used to educate patients. Let's say a stroke patient is not a candidate for TPA. By explaining the risk of hemorrhagic stroke up front, they will understand the use of TPA is inappropriate in this setting. If they hear about TPA in the future, there shouldn't be confusion wondering why it wasn't administered. When patients were admitted to the hospital in the past, it was their internist who managed their care. The patients felt more comfortable with this daunting experience of being hospitalized because their doctor, who they trusted, was looking after them. Typically today, a patient's path is to see the emergency physician and then to be handed off to the hospitalist. Throughout the process, we try our best to convey confidence that we are knowledgeable, competent, and caring. It's not uncommon for me to interact with doctors whom I've never met, but I've seen those interactions improve after positive imprinting. Not very long ago, I dined with 3 Lake County Medical Society surgical colleagues. The social interaction fostered imprinting of mutual trust. The doctors work with me at Vista Medical Center in Waukegan, but at the time of the dinner, I was new to the system. A couple of days after our dinner, I consulted one of the surgeons. You could tell by the tone in our voices that trust had been established. I have no doubt that the professional relationship established had smoothed the transition of the patient care. Let's apply this approach to our dealing with each other in the workplace and here at the annual meeting. I believe job satisfaction and patient care will improve by fostering relationships between each other as physicians. Membership recruiting can improve as these professional relationships are nourished. I've gotten to know many of you and look forward to meeting more of you in the coming year. ISMS is a place where our voice can be heard. This is a message we need to convey to our members and non-members alike. Last year, I experienced this firsthand. I was discussing the opioid abuse issue with one of our lobbyists. I referenced the dilemma we face prescribing medications. Doctors are rated by patients in terms of the service we provide. A patient seeking narcotics or an imprinted parent seeking antibiotics for a viral infection leaving empty-handed will likely be dissatisfied customers. That person has the power to rate us accordingly when given the opportunity. A similar sentiment was echoed by another physician during the Council on Medical Services meeting. Our lobbyist shared this perspective with the legislators and the task force members looking at this issue. Our voice was heard. This sharing of perspective is replicated many times over on a multitude of issues. Here's another example. Because of the fierce advocacy of ISMS, we have successfully communicated the need for CPT codes for advanced care planning discussions. This initiative came to being from a request from the members of the DuPage County Medical Society. Similarly, the Pulse Advanced Directive is a much better resource, replacing the DNR that came before it. At this meeting, we have discussed, deliberated, and cajoled on a number of issues, large and small. The decisions we make here will live on after the meeting and support the actions of all of us and the entire profession. We are all here because we want to be heard. The Illinois State Medical Society is the vehicle where this happens. As ISMS leaders, we need to listen to our colleagues and convey their messages or to teach them how to participate with the medical society directly. After all, we were inspired to become physicians and further to serve in leadership. My inspiration to become a physician came from my father. This year, my father would have been 100 years old. He wanted to be a physician, but he didn't have the opportunity to do so. During World War II, he worked in aircraft engine manufacturing. As Malcolm Gladwell suggests in his book Outliers, the timing of when you are born can change your path in life. My father was too old to serve, thus he was unable to access the GI Bill and go to medical school. But I remember him talking about it often when I was young, and there was an imprinting that drove my desire to become a physician. I've shared a little bit about what I do and what inspires me. Now I'd like to tell you about myself. Those of you who know me know that I'm an avid dancer. Again, my father was my inspiration. He is the one who suggested I learn to dance. It has changed my life. It's a great icebreaker and a fun way to meet people. My favorite dance is Argentine tango. Next year, I hope to have dancing at my President's Night party and an intro dance lesson at the meeting. I also like to golf, which I do with my boys. Now my daughter is becoming intrigued as well. Strangely, tango has helped my golf game with a greater understanding of body rotation. All of you golfers in the room take notice. I hope to see you on the dance floor next year. I also have a robust in probability and statistics. It is this curiosity that will help explain one of my goals as president. I think there's a role for ISMS in helping to improve our members' experience with the various systems of measurement and rating which are now part of our daily professional lives. Take, for example, patient assessments, now routine through formal survey or on the Yelp universe. Yes, as scary as it seems, Yelp and Angie's List, the same venues used to scream about cold soup and tardy painters, are forums for assessing our performance as physicians. My tango instructor said, if you know the rules, you can break the rules. Sometimes providing the best possible care can appear to be breaking the rules. For example, I was recently taking care of a patient with chest pain. There was ST elevation in one isolated lead. This, of course, did not meet the criteria for immediate angioplasty. When the troponin came back elevated and there was ongoing chest pain, it was clear that the patient was having a heart attack. I spoke to the cardiologist and we agreed that the patient needed to go to the cath lab for immediate angioplasty. Of course, this fell out of the 30-minute door to balloon time, but it was the right thing to do. The cardiologist and I were challenged on this, ironically for acting in the best interest of our patient. But we have to understand, hospitals are fearful over how they are being measured as well. As physicians, we are measured by Medicare, hospitals, insurers, and many of us face evaluation from our employer. Of course, we should embrace measurement when it is done constructively and not in a threatening or punitive way. We should take a close look at the value of measurement, what is being measured, and the validity of the data collected. Not too long ago, an essay entitled "Doctor, Shut Up and Listen" appeared in the New York Times. The point was, we don't spend enough time discussing and listening to our patients' concerns. Ironically, a physician friend of mine told me that she had been dinged by her hospital for spending too much time with her patients. My point here is that there is a place for ISMS to insert itself as the measurement and medical technology revolution continues. And if we work together on this, our combined voices can be a powerful voice. The practice of medicine has been wonderful for me. Of course, there have been some challenges along the way. Sometimes technology is a blessing, and sometimes it's a curse. Before the internet, I was frustrated with no connectivity to the radiologist after hours. Now with technology, we can use a CAT scanner to diagnose appendicitis and pulmonary emboli, to name a few. This improvement to patient care makes the practice of medicine more fulfilling. Among the modern technologies that have changed patient care is the electronic medical record. Insertion of this tool into practice has mixed consequences. It has created a physician-computer relationship that competes with the physician-patient relationship. Sometimes a family member tries to establish a relationship with the physician during the patient's examination and starts talking about their own medical problems, which is most likely a manifestation of their personal fears. A friend jokingly said that this person is the narcissist in the room. Unfortunately, there is a narcissist in the room of every patient I see. The narcissist is the computer on wheels, COW, or cow. And can you believe it? I was recently informed that cow is not politically correct because of the obesity epidemic. So to keep us PC, the new acronym is Workstation on Wheels, or WOW. The medical chart is a tool physicians rely on to track care and communicate. A physician recently told me he longs for the paper chart, a concise tool for the healthcare team to share patient information and clinical assessments. Review of systems and past medical history should be data collected when relevant to patient care, not for over-documenting to maximize billing. Is the data we enter into an EHR system necessary to record the medical care of our patients? Or are we really serving the gods of billing and data collection as we click through the 9th and 10th drop-down menus? The federal government wanted meaningful use, but isn't really much of this meaningful billing? This is something that ISMS is already trying to address. The Society participates in all of the state's interconnectivity initiatives, shares information on compliance issues, and has provided a host of other resources to members. We already have the ISMS Hassle Factor Log, which has been a helpful tool for collecting information on common payer issues. Our health policy team leverages this information when explaining the physician side of issues. I'd like to see us use a similar collection tool to address the electronic medical record frustrations doctors face. Let's advocate for a medical record that is an efficient communication tool that increases physician productivity. ISMS should be center and foremost in making sure that EHR systems work in the best interest of physicians and our patients. It is here where we can be heard. At ISMS, we can make a difference. At ISMS, we have a voice. As I mentioned earlier, casual social interaction amongst colleagues fosters trust. I'm serious when I say I want to get to know you better this year. Not too long ago, I took the Color Code personality test. It's a quick assessment tool that rates you into one of 4 color code personalities. I'll add a disclaimer here for the psychiatrists in the room. I'm not recommending the color code test replace the DSM-5, but I found the test to be instinctively insightful. A red person is someone who is a power wielder with the ability to get things done. I see a lot of reds in this room. A blue personality is someone considered creative and a bit of a do-gooder. They are loyal, sincere, and thoughtful. Many of you are represented here as well. The color white is identified with the peacekeepers, those able to keep calm and balanced in the midst of conflict. We appreciate you the most when 10 resolutions stand between a reference committee hearing and the lunch break. Lastly, there are the yellows. These are the fun lovers, living life in the moment. They are enjoyable to be around, enthusiastic and sociable. And I want to emphasize the social. You can go to the Illinois State Medical Society Facebook page to take the color code quiz yourself. I need to amplify the yellow in myself, and I urge you to do the same. When I've allowed myself to be more sociable, to introduce myself to someone I don't know, or to get to know someone better, I've met some amazing people. This is an important component of our time spent together here, the opportunity to get to know each other a little bit better. I firmly believe that the social interaction and collegiality we experience during these meetings serve a very important function. In summary, the Medical Society of the Voice of Physicians, we need to get more comfortable sharing this with others. This is a fact imprinted on me at work, at ISMS, or when dancing. By getting to know each other, the experience can be so much better. So now let's go forward together. Here at ISMS, we can make a difference. Here at ISMS, we have a voice. And here at ISMS, if we work together, our combined voices are a powerful force. Thank you.